It's time for NuWellness TV with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Boy, do we have a show for you today. Dr. Gary Gordon is my guest, and because his bio is so long, we have decided we're going to jump in to talk about what this show is all about. We have a lot of information. He informed me that he has hundreds of slides. I'm just kidding. But we have to get through this information. You can Google Dr. Gary Gordon. He is an amazing practitioner, always on cutting edge of everything. I'm so happy that we're going to be doing some work with you on this project. So I am so excited. I am so excited that we're going to be talking about something that everyone should be watching. Everyone. I just had a birthday yesterday. And the reason why I'm saying that is because my biological age and my chronological age do not match. And I'm so happy. I'm 25 years younger. There's a reason for that. We're going to be discussing quite a few things and give you some health facts to lengthen your telomeres. So if you don't know what that is, you're going to hear Dr. Gary Gordon bring you everything straight from the expert. Thank you so much, Dr. Gary Gordon.
Thank you. It's my pleasure to be here.
So we're just going to jump right in. You know, the title of our show kind of shifted a little bit. You sent me health facts. You know, there's so many facts as it relates to health. There's so many things that are happening that's new currently. So I want you, we're just going to start. You and I have so many conversations that this is just almost like we're having a conversation. But this time we're actually going to be sharing this information to help people. Because not only do you look at lengthening the telomeres, but you also want to keep in mind that you are helping yourself prevent all these other so-called aging problems that people have. So let's get started. What's new?
What's really new is that we now understand the importance of the telomeres, and we know that just like you might be chronologically 65, but you sure don't look a day older than 40. So the difference between biological and chronological is now available for everybody to test on their own body. And the credibility is so powerful that the former director of the FDA, David Kessler, is saying, folks, all this stuff looks 100% real, because for $89, they'll send you something in the mail, and you can stick a tiny needle in your finger, get one drop of blood, send that to the lab, and they will tell you, are you 65, 95, or 45? So the biological age is now going to be available for $89 for anybody. And when you go to the bookstore or go on Amazon and order the book called The Telomere Effect by Nobel Prize winner Elizabeth Blackburn, that book is going to change the practice of medicine, folks, because right now, Dr. Cherilyn Lee and myself, when you come to me with, say, auricular fibrillation, all the mainstream doctors are going to put you on drugs. Yeah. People come to me because they know there's side effects of drugs and they want to be treated naturally.
Yes.
So one of my patients, Pastor Benny Hinn, was cured of his heart disease within 2 visits. So he likes to help us get the word out that what Dr. Lee and I teach is real.
Yes.
And the reason I'm excited about the book is because the book has got all the documentation. This book, you must own it, because you can't believe how many details are in this book. For example, a lot of us have been teaching that we should take an antioxidant.
Yes.
Well, the problem is the book points out that it's when you eat the right foods that you really get the antioxidant effect, because many of the tablets we take do not deliver an antioxidant effect.
Mm-hmm.
And so what I'm excited about is being able to protect the public and show them that when you go to one of my chelation doctors, you really are getting a benefit. We've spent now with NIH over 30 million from the first study, and we're starting a second study for 37 million to prove that if you're diabetic, we reduce the risk of sudden death by over 50% when you get chelation. Well, that's really wonderful, because I have spent a long time working to bring chelation to the tablet instead of just to the vein. But everybody needs to know, is all this stuff quackery and nonsense? Are they just taking my money, or am I getting an effect? So since I'm 82, I, like Dr. Lee,
You look fabulous.
have had some biological benefits,
Mm-hmm.
because I was born very sick. When I was in medical school, could barely go up a flight of steps. And I, as a kid, ran high fevers, and I had a sweet tooth. Sugar is worse than smoking, folks. And I wound up with a lot of fillings. Every tooth had mercury in it.
Mm-hmm.
And one very crazy dentist took all my fillings out in one day and put them all in new. What did that give me? Taking the old ones out, I was breathing fumes. So when I got out of the dentist office, I laid down in the back seat of my father's car, and I could barely walk for the next 6 months. I was unconscious. So I really had mercury poisoning.
Yes.
So, of course, as a very sick doctor, unable to be physically active, when I heard about chelation, I thought, well, just like the folks hearing me talk now, they don't know, is this real or is this nonsense? And I didn't know, because this is 45 years ago. But the 8th chelation allowed me to become physically active like normal people. And so I spent the next 45 years lecturing around the world to let doctors know that EDTA, which is the chelating agent we use, there's many agents, even vitamin C is a chelating agent, so is garlic and zeolite. But after the 8th chelation, I had a new life. And so I owed it to the world to bring this to the attention of the world, and I'm so glad that NIH finally listened, and we've had not just the first study, but the second study, and that's going to mean that people can do a simple drop of blood from a kit in their mailbox, which they send to the lab, and it tells them how old they are biologically, because you know your chronological age is your birth date.
Mm-hmm.
But your biological age tells you how much longer you're going to be around, because we now believe that these bodies can easily function to 110 and 120.
And not only how long you're going to be around, but your quality of life.
Exactly.
The quality of life is so important. You can be here 80, 90 years, but if you're bedridden, that doesn't make sense. That is no quality of life. So this is why we're speaking on what we're speaking on today, because we want to live longer but have the best quality of life.
So I've written nutrition books, Detox with Oral Chelation and Chelation Therapy as the alternative. I've written these books, but now you have to take my word for it. But when you have the biggest names in medicine, including the former director of FDA, endorsing this new book, you are in a position to open the book and see that it says that vitamin C is going to extend your lifespan. And so it's nice to have nothing more to fight about. So if it's going to work, then the question is, what else? And it says vitamin D is going to work.
Yes.
And having meaningful relationships is going to help.
Oh, yes.
And cleaning up our neighborhood. So all the things that Dr. Cherilyn Lee has been teaching are now being validated by a Nobel Prize winner. And wait until you get your copy of the telomere effect to see that everybody who's anybody in the field of alternative and advanced medicine has endorsed the book. So that's not a big deal, because the big is this: what can combine and what will destroy the effect? So the cigarette is bad, and the soda drink with the sugar is shortening your lifespan. But it turns out that dark chocolate is really very safe. And it turns out that you can actually do other things like drink coffee safely, but not loaded with a bunch of sugar. And so there's so much to learn.
Yes.
But I'm at 82, I'm so optimistic because my friend Dr. Norman Shealy, Harvard-trained neurosurgeon, has already done a 5-year study on his patients doing this test. And most people, when they get the test done, show that they're 1 year older.
Mm-hmm.
His patients got 4 years younger every year that went by.
My,
so
yes.
they have been combining more than one thing. So the more good things we do,
Oh, yes.
the better all this pays off.
Yes. And you know, the one thing about the vitamin C IV therapies is not only lengthening the telomere, but also it's so good. And when we say lengthening, instead of saying anti-aging, anti-aging is really shortening the telomeres. They're getting shorter and shorter. If you agree with me there. And what's happening with that, this is why your skin, Dr. Gordon, is so beautiful. And people are always asking me, you know, your skin, this looks wonderful, not knowing that this is what I've been doing through the years. And, you know, and living right and staying happy as possible, you know, and
Yes.
in a world of madness, we find some joy and do things for ourselves. I know my daughter's always on me. It's like, Mom, you got to start doing more for yourself. You do more for the patients than you do yourself. So I hear about it a lot. So I do take time out for myself. But I just want to say, because your skin, it's glowing. It looks very healthy. For a person of your age, it looks very good. Without any Botox.
Well, it turns out that I have the gene for skin cancer, and this is a skin cancer that I'm playing with our natural remedies, because I was born and raised in Madison, Wisconsin, and Dr. Friedrich Mose at the University of Wisconsin treated my mom for her breast cancer, skin cancer, and I wound up learning from him about a simple black paste with zinc in it that I bought from the University of Wisconsin, and I used it on my patients when I was practicing in California. But there was no money in the black paste because it made everybody's cancer so easy to treat. So even though I have used from the University of Wisconsin pharmacy that black paste 35, 40 years ago, they now claim they've never heard of it and they don't know how to make it. So now they want to do surgery on me, and they call it Mohs technique. Mm-hmm. But he was using the kind of things that Dr. Cherilyn Lee and I believe in, the natural things.
Yes. And I'm so grateful. And just, you know, to step back a little bit, and Dr. Gordon has been with the ACAM and all the organizations that he is involved with. And I just admire the fact that he travels all over the world to find the latest technology and brings it back to us as well. And I'm happy to have a friend like that. But can we go over some of the things that will happen to people medically when they have shortened their telomeres? And, you know, people need to know I want you to explain what telomeres are, and then some of the conditions that are associated with having this process happens. So people don't realize if you're looking older and if you have all these wrinkles on the skin, which is an organ also, what is going on internally? So if you could share this with our viewers, I greatly appreciate this. Thank you.
It is so amazing that we can pick up this book and learn that just like on your shoelaces, you have a little cap so the shoelace doesn't unravel. Mm-hmm. Our God put a cap on the end of our chromosomes so they don't unravel. And that cap is what we call the telomere. And for it to absolutely become shorter, it's like you're losing that little hard end on your shoelace, and one day there'll be no end and the shoelace will unravel. Mm-hmm. So it's such a simple concept, but it's a test that we can do on every inside of every cell. There are all of these chromosomes. So it is so simple now with laboratories that they are using this test around the world. And it didn't just come out yesterday, but it requires acceptance in medicine because at first everything we're skeptical about. But now we can document. So I want to go ahead and put some slides up so I can help our viewers.
Wonderful. Thank you. And you have a wonderful supportive family there.
This young lady has done all my slides for years and years of all my lectures. So she's used to me always wanting to put more stuff in and do new stuff. So you'll be able, the slides will come up. There they are.
Okay, wonderful.
Okay. So
press enter.
This, anybody can go to the Google and you'll learn all you need to know about my life's work, because I've had the privilege of having 4,300 doctors join my school, which is kind of online or on the internet, called FACT. Mm-hmm. So we want everybody to know that I helped found the American College for Advancement in Medicine.
Yes.
Because when chelation allowed me to have a normal ability to go upstairs after I couldn't go up a flight of steps for the first 30 plus years without a lot of trouble and shortness of breath, I moved on into the field of working and measuring your magnesium and your zinc and your lead and your mercury. And so Mineral Lab, we took a piece of hair from people and we burn it in a special furnace, and the intensity that it burns at allows me to know how much lead poisoning you have, because we are all born today with between 500 and 1,000 times too much lead. So that's part of why I put everyone on vitamin C and zeolite and homeopathic detoxification, because there is no safe level of lead.
No, there isn't.
So I wind up age 82, as I said, sick a long time, but my included falling asleep in the daytime, malabsorption. I couldn't keep my head up. My bones were osteoporotic, lots of problems. No stomach acid. Most foods really upset me, so it wasn't too good. And I was one of the early ones to learn that fish can give us the right oils that we need. But today, some people are getting their oils from algae raised in tanks because it's impossible to get something from the ocean that doesn't include some mercury. So I wind up that I'll be putting everyone on chelation.
You know,
so you don't have to be so frightened.
Not to cut you off, I just want to say,
the bottom line becomes, what do we eat since we have poisoned our planet? And there's a really good book, which is not in these slides, but I'll mention it. It's called How Not to Die. We'll get back to that in the future, but I just want everybody to know that the Chelation Answer was one of the very first books that I put together so I could teach doctors and put on these conferences in every country. And because doctors, when they hear of something, they don't know if it's real or not. and they have to be skeptical because remember, it's a competitive world. And we put bypass surgeons out of business because I have never had in over 30 years a patient have a fatal heart attack or stroke when I have them on my program. So the program involves oral chelation, and this book and the other books are all available on Amazon. And this is an easy way for people to be able to understand that since Harvard agrees, everyone starts with between 500 and 1,000 times too much lead in your bones and your cells the minute you come out of your mother's body. Because actually, the good Lord decided to protect the mother's health and put the lead from her body into the baby. So I will be bringing out products in the near future that everyone can take during the pregnancy and every day of their life so that they will be getting rid of the lead and mercury that's in all of us.
Wonderful. And it's safe during pregnancy because people don't realize that how many toxins or will present through the umbilical cord that goes straight to the baby before the baby's born. The baby's very toxic. Research has shown that over 200 toxins will enter the baby before the baby is born. So the baby's already born toxic. So we want to do everything we can during pregnancy. If you're pregnant, give us a call and let's make sure that you're on the right program and things that are safe during pregnancy. Yes, I want to thank you so much for the telomere effect. So let's continue with the slides, because I know you have quite a few. We're going to move a little faster here.
Okay, so we'll be talking also about how we can make homeopathic drops that will help your body push those toxins out. And so if we're going to all feel like 40 when we're 80, we're going to really have to steady the wonderful, organized, solid-based research that they have put in this telomere effect book. And we're going to move on and let you know that from the information in that book, you'll begin to be appreciative of the beautiful neighborhoods where you feel safe, and there's trees and greens and the exercise and the pets in our life. And this book puts it all together like we've been trying to do, but never have we had it all together in one book. So this is the doctor, cardiologist at Cedars-Sinai in Miami, Dr. Gervasio Lamas, who had the courage to step up and agree to study my chelation. And he's from Columbia University. He's as high up in cardiology as you can be. And in spite of that, he willingly took on my chelation and agreed to be the head of the research project, which has been completed, which documented a near 50% reduction in death in diabetics who are lucky enough to get chelation. Because it turns out, technically, since you're born with lead poisoning, how long does it take if you were my patient? And I started you on chelation. It takes 16 years for your body to make all new bones. And therefore, you have to stay on the chelation for that entire time. Now, another thing that motivates a lot of us is we are all worried about cancer.
Yes.
So my good friend, Dr. Jenny Herbertek, wrote the book because they lied to her and scared her with her breast cancer that she had, surgery, chelation, surgery, chemo, and radiation. And then they told her, we've cured you. So I said, they lie. And we took her blood and we ran it to the laboratory and proved at the RGCC lab in Greece that you could see the cancer cells still in her bloodstream. And now you can grow the tumor in the laboratory and find out what works best. Does vitamin C do it, or do you need some chemo? So anyhow, it's an exciting time for us to know that I can take and make it easier to understand that food and part of our problem, we need to know what to eat. And all of us, when I look with our new test CyberScan, have some form of fungal or viral or bacterial infection because we have so many toxins, our immune system can't keep all the infections gone. And G is for genetics, and as I said, I have the gene for skin cancer. H is for heavy metals, and I said we all have heavy metals. And then H is for hormones, because we have an amazing product called Herbal Remedy from Thailand, HRT, which helps all my patients have strong bones when they're 80 and 90, but it's not estrogen. And then I do use a topical cream to get some testosterone and other effects. And then we need patients to know that all of us have such low levels of iodine. In this country,
most definitely,
we get about 1% of the iodine you get in your diet if you're in Japan. And so I have people going to the health food store and picking up iodine. But we need people to know that doctors, and including myself, are hard pressed to get the big picture. We all want to talk about either the lead or the mercury or the diet or the stress, but there's always a piece of the puzzle. And that's why I used this acronym, the simple acronym of food infection genetics, in an effort to try to help people understand that we can address everything: food, infection, genetic, heavy metal, hormone, toxin. And we now are using things like silver. And silver amazingly replaces antibiotics.
Yes, it does. I use it all the time.
And antifungals. So it really has helped us tremendously.
Yes.
And we know that we can get 99% of the bugs gone with ACS, extra strength silver, which comes as a spray, and you just take 5 or 10 sprays, and you can give it to babies. You can use it for everybody. And it's so sad that we keep giving people antibiotics, which disturbs our intestinal flora so that we don't have the good, healthy bugs we need.
Right.
Silver
You know,
is
just
one-
want to say also,
Yes.
with using the silver topical is really good for conjunctivitis. People with eye infection. I used it because when it's a very, very windy day, when the wind is high, I would use a lot of the silver sometime, because you get all these dirt and particles in the eye, and it's so easy to get, contract an eye infection. So this is so important too, to help with the overall immune system. I tell people, keep it in your medicine cabinet. That's something colloidal silver, or the silver product, is so important to keep on hand for your children. I had a person with a bee sting, and they would not go to the hospital. And I was in the clinic, and I said, you really need to go. The child was stung by a bee in the elevator, and placing just a little colloidal silver gel until the paramedics came. By the time they came, the redness was gone. The child was fine, but it was the silver gel made a big, big difference. So the gel is so powerful. I just want to say that everybody should have that in their home all the time. So you can, we carry his products also. We'll be carrying them. So if you have any questions, you can always give us a call at 310-419-4300 at NuWellness Healthcare.
And to back you up, I use that gel so that I don't do surgery on my skin cancer, and
Yes.
that gel keeps it in control. So I couldn't agree more. You can't run your home without having the spray.
No, you can't. And you know what I want to say too, I don't want to cut you off again, but I take the silver for people who have had skin cancer, and I have them mix it with colostrum.
Great.
With a little colostrum, and make a paste and put it on there. One gentleman said in 2 days he was taking a shower and just fell off. So, so I was so happy to hear that. So there's techniques and things that we can do to keep our body healthy. And then when things do appear, there are things we can do naturally also, but always want to follow it up. Lacey was a patient of mine, and we also saw a dermatologist to follow up to make sure everything was fine. Because, you don't want to practice a lot of medicine on yourself without having an expert there to work with you, a practitioner to work through everything. So even though you're looking at everything here on the show, keep in mind that it's so important that this is what you need at this time, that nothing is overlooked. This is why going through the testing that Dr. Gordon has expressed to us, you can find out at a cellular level what's going on. Let's deal with that now. Let's not wait until later that you have symptoms of dementia or you have cardiovascular diseases or you have all these conditions showing up. Let's take the test now. You know, I'm 25 years younger than my biological age, but I'm telling you, it makes a big difference. Makes a big difference to know. But a lot of things I've been doing for a long time, considering I've been in 2 comas and a lot of people know my history and all these other things that have happened to me. I said, I'm going to be here for a long time. My daughter made a comment. She said, you know, your father lived to be 65. He had heart disease, cardiovascular diseases. And I said, nope, I just turned 65 and I will be here much longer. So his father lived to be 100. So I plan to be here to be 100, but his quality of life was great. He was just ready to go at 100. So we're going to go into a commercial. We want to thank our sponsors. One moment, Dr. Gordon, we're going to do a commercial real quick here. We're going to come back and let you kind of wrap up some things real quick, because our segment of the show, I have my wonderful co-host for our Dining Out Healthy is here, and we're going to be talking about some things as you can dine out healthy in some of the restaurants. But just want to talk about what we do at NuWellness Healthcare. NuWellness Healthcare is our sponsor for the NuWellness TV with Dr. Lee. I want to thank everyone for listening in. We offer the vitamin C IV therapies, which you see there, and so effective for so many things. And as you know now, to lengthen the telomeres is really important. It's another way to say that is, I don't like anti-aging neither, but you want to stay looking good. But most important, not just looking good on the outside, but also have a wonderful internal healthy body. You know, have a sharp mind. Those things are very important as we grow older gracefully. So I just want to thank you, NuWellness Healthcare, for being our sponsor for this wonderful 1-hour TV show. We'll be coming back with Dr. Gordon. He's going to kind of wrap up some things, because we will be going into the last component of our show, our featured guest, who will be here with me on the show every week as we deal with dining out healthy with Dr. Lee and Marie. Dr. Gordon.
Good, thank you.
So in this short period of time, I know because we had a little late start, but in this short period of time, what would you want the listeners to know that's going to be very powerful? And we're going to have you on again, because it's just too much information to cram it into less than an hour. And so we're going to have you scheduled to be back on again as soon as possible, if that's okay with you.
I would love that. Thank you very much, Dr. Lee. You bet.
Yes, and I saw the book up there, my dear friend. He's been a guest on my radio show in the past. Just amazing. So tell me about this device that you had there.
That device is moving us from the area of biochemistry into physics.
Okay.
And that's why I'm so excited about the telomere, because my doctor friends who combine the use of the laser and the microcurrent and the magnetic therapy and the hyperthermia and the ozone, along with the good things and supplements that we all have to take in the right diet, are getting dramatically younger. So that was just showing some people that there's all the physics of the microcurrents and the magnet and the lasers, and they can be combined with our vitamin C and taking all our supplements. And the net result is we can do amazing things. And when we combine the vitamin C with the EDTA, we actually can get lead out of our brain, and we don't have to have all these children with autism and hyperthermia. So it's a big process that blood lead levels actually predict how long you get to live. And so there's a lot. We know that it takes 16 years to make all new bones. So you've got to be on a serious program continuously. It's not just going to take 1 or 2 chelation. That's why the oral is so important, because we'll be on it for a long time. And zeolite actually has the ability to help our body deal with many of these toxins, just like homeopathy can move out toxins. So where we're at is that we use the fiber. We have to all nobody has the right intestinal flora without getting a probiotic and a prebiotic, and everything is multifactorial. That's why I remind everybody that it's this mitochondria, which is at the end of the mitochondria where we get into the telomeres, and the exotest is an easy way that allows us to find out what's going on in our body with our use of minerals. Most of us are magnesium deficient.
I hate to cut you off, but I know that, in lieu of time, we have to move on to the other segment. We're going to have to bring you back on very soon here, so we need to go over this cyber scan.
You bet.
But we're going to have to let that be part 2, because that is so important to bring that on and let people know what that's all about. So I'll give you a call, and we'll have you back on as soon as possible here, so we can talk about that. I want to thank you so much for taking the opportunity out of your busy schedule to be here with us on the NuWellness TV show. Thank you so much, Dr. Gordon. And
Thank you,
will
Dr.
be
Lee.
calling
it's
you.
my pleasure.
Okay.
Your show is going to help a lot of people. Thank you for putting it together. Thank you.
Thank you. I'll be calling you.
Thank you very much.
Thank you. Now we're going to move into our segment on dining out healthy with Dr. Lee and Marie. We had some fun this weekend, and we actually visit a restaurant here in Inglewood.
Yes, we did.
Stuff I Eat.
Yes, we did.
So we had a great time there. So I'm going to open it up. And I want to say, in people going out to eat, you want to know what type of oils they're using. It's very important what type of oils they're using, what type of utensils they're cooking in. And I noticed at Stuff I Eat, we used utensils. We used regular utensils. We didn't use plastic, which I really love that.
Yes.
So it was really important. So I'm going to let you take it from here, Maria, and talk about those wonderful dishes that showed up there on the screen at Stuff I Eat, located in Inglewood, California.
Well, I've always wanted to go there, so it was a wonderful experience. So we were able to just drop in and order some amazing vegan, eco-friendly food, which is all plant-based, by the way. And the importance of choosing what you want to eat is so important. Because dining out should be an experience, not just, I'm going to go grab a bite to eat.
Yes.
Taking the time to really sit down and enjoy your meal, enjoy the company that you're with, as well as enjoying the foods that you are ordering.
Or if you're eating by yourself, you still be able to,
Absolutely. Mm-hmm. And the wonderful part about that is when you're ordering your food, you have every right to ask the server or the chef or whoever's present, what's in your meal? How is your meal prepared? If there's certain things that you're choose not to eat, they can actually substitute the foods with the choices that you want. If you don't want the potatoes, you want to have a salad, you have every right to get that, whether it's an extra charge or not. So you can play with it, play with the menu, have fun with it as you're going out, and make it an enjoyable experience.
Most definitely.
And, I find that sometimes, we pay for food and it's not exactly what we wanted.
Well, you had an experience last night. We're going to talk about that experience because I think you left there in a way that I would have handled it a little bit differently.
Yes.
Because if you're going to spend your money on something, you want to get what you spent your money on.
Yes.
So I want you to kind of share that experience because this happens to a lot. Excuse me. This happens a lot to people. So share that experience, please.
Well, what happened last night, it was late. We were kind of finding a place to go that was about not to close in 20 minutes. So we went to a place that I've frequently before. I'm not going to say the name.
No.
No. And so, they just had a very limited menu. So I just ordered and I asked the waiter, how it's prepared. And he told me, I said, okay, I'm going to try this. It sounded okay. Mm-hmm. We brought our food, and me being a chef as well, I had asked for some black pepper and some little bit of Parmesan cheese. I had ordered a pasta dish. And the waiter said, oh, we don't do that. I said, excuse me? He said, we don't do that. And I said, why is that? And he said, well, the chef wants you to experience the full flavor of the food, which I get. I'm a chef, so I understand that. Mm-hmm. But I think you should have an option of adding to spices or things that you want to flavor the food even better.
Yes.
So with that being said, the noodles were so hard. The dish I was not pleased at all. And normally I would have said something, and I didn't. For whatever reason, I chose not to.
Yes.
And I just said it was okay. I didn't say it was delicious. And for the price that I paid, which was ridiculous, and the amount that we were given, I would have thought that, okay, fine, this is going to be so delicious, it's worth it, right? Well, it wasn't. So that was my experience, and I think when you go out, you should have an opportunity to ask for what you want.
Yeah, and I just want to say we're not speaking of stuff I eat.
Right.
Because
Absolutely not.
We want to put that back up there. We want to put the name of the store, and we want to put the food that we actually enjoyed. It was just absolutely wonderful.
And it was worth every penny.
It definitely was.
We walked out of there completely satisfied. We were healthy, feeling good. We met some amazing people, and all the dishes. I will definitely go back and try some more of her food. Mrs. B, we didn't get an opportunity to meet her, but we did meet her daughter, who was lovely. So I look forward to checking the place out again.
You know, and we're just doing this as a shout out to let people know. So if you're in that area of town and you want something, because a lot of times I'm driving, it's like you don't plan sometime to go somewhere.
Right.
I want to go get something good to eat, but I want something that's going to nourish my body.
Correct.
And I want to know that it's authentic in what they're doing and not something that's going to harm me in the long run. So, and I hate to say harm coming from a restaurant, but I've had food poisoning on many occasions. So.
Absolutely. I think the food, even at the end of the day, we talked about this last night, the food should be the same as if you would have ordered at 6 p.m. for a dinner as it was before closing. And I think they were rushed. They made it just half-assed. There was, honestly, I felt there was no love or any passion put into that dish. It was just, let's just get these people fed so we can close.
I've been there.
And so that's an important thing also when you're deciding to do that. Sometimes perhaps it may be better just to go home and make a meal than trying to get something on the fly at the end of the evening. So those are just important tips as well, I think.
Wonderful. And thank you for those tips, because
you're welcome.
I've been there too, and I'm glad we had a chance to share that. Your experience last night.
Yes.
So I want to say that it's a wonderful. This is something new that we're adding to the show. If you have a restaurant that you like and you think we should go there and talk about them, please, you can always email me at dr.lee, D-R-L-E-E, at NuWellnessHealthcare.com. And we will get back with you and check into that. I think it's very powerful to see what other people have to say about what places they are frequenting.
Correct.
To go and eat. And
there's some amazing places here in Los Angeles, all over California.
All over California.
So I'm really excited.
Yes. And pretty soon we'll be traveling outside of California.
Yay.
But I want to say thank you so much, Maria. You are absolutely wonderful. And thank you so much for taking on this endeavor. And we're going to close the show. And as I don't have my little button on tonight or today, I want to just say, repeat after me. I am so grateful that I am a magnet for miracles. And keep in mind, each one teach one. Please share the show with others. At NuWellness Healthcare, we believe in the vitamin C IV therapy. Very simple therapy. There are some blood tests that must be done prior to your tests. And I want to thank again Dr. Gary Gordon for being a guest today. And thank you, my associate, for dining out healthy, Marie. Thank you so much for being here.
Thank you for having me.
Thank you.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.